Thanks for coming today, and I have the pleasure of introducing our speaker, Starr Frechette. Ashley is the Director of Health Professional Outreach of the Connecticut Coalition Against Domestic Violence. She has her Master's of Public Health degree from Northeastern University and educates and trains health professionals across the state on intimate partner violence screening and intervention. She oversees health professional outreach and advocacy programs and various health programs. Ashley is a member of the Governor's Council on Women and Girls, CT's Maternal Mortality Review Committee, and she's a certified choices counselor. And I would like to now pass it on over to Ashley.
Yeah, so like it was said, my name is Ashley Starr Frechette. I'm the Director of Health Professional Outreach of the Connecticut Coalition Against Domestic Violence. If you aren't familiar with the Connecticut Coalition Against Domestic Violence, we have 18 member organizations that work across the state. So no matter what area you are in, hopefully we can help you get connected with your local member organizations. And for those of you who have heard my talk before, hopefully this will be a little bit different. I tried to, I know I have an hour and a half today, so this will be more of like a deep dive into a few different topics. I added in some information on strangulation and a lot of the maternal stuff that we've been working on, just so we can kind of get a full grasp of like what we do here at the organization, especially when we're talking about health and community providers and different organizations and how they can help support the work that we're doing here. So I'll go ahead and start, but obviously I always want to start and say that, domestic violence is a really sensitive topic and it affects so many people. We know 1 in 4 women and 1 in 7 men have been severely physically abused at some point in their life. So if you need to step away or, make sure that you need to take care of yourself. So if you have any questions, my information is at the end. And I'm happy to stay on after. You can always send me an email, or obviously our statewide hotline is always available. So please don't hesitate to reach out if you have any concerns, questions, or if you just need a minute to step away. I also just want to mention that in the state of Connecticut, we do unfortunately see a higher the majority of our clients are individuals who identify as female. So I tend to use like she when I speak, but that does not mean that is all that IPV is. We have unfortunately seen a much higher increase in individuals who identify as male coming forward. And we obviously know that in communities, trans, different communities, we see that there's such an increase in IPV, but we see very few people actually coming forward. So our hope is that we can continue to get the word out that these resources exist and to better understand what violence is, because at the end of the day, like we don't necessarily all grow up in a perfect home where we see an example of what a good relationship should be. And every relationship is so different. So trying to help people, realizing that at the end of the day, like what we assume is a healthy relationship might not necessarily be that. So trying to help people and guide, especially if you're working with individuals from the younger ages, all the way up till whenever you end up working with them, just to let them know like what resources are out there, what a healthy relationship is. Because sometimes we just don't see that we are in an abusive relationship when we might be. So it can be helpful to have those kind of conversations with people that you might have in your life that have those different things going on. So today I'll kind of just talk through what domestic violence is, different challenges to leaving. So a lot about coercive control and what we see a lot of as to why individuals stay in abusive relationships. And then I wanted to talk, take a deeper dive into the health impacts of intimate partner violence, knowing that each of you have different areas that you work in. So there's pretty much every aspect of life, intimate partner violence is there. So whatever area you work in, I'm sure that you have encountered someone who has been in an abusive relationship, or maybe you don't know that they are, but hopefully after this, it'll be helpful to see some different aspects of this that you might be able to help someone find resources for. And then, of course, we'll go over what the resources are. Has everyone here heard of CT Safe Connect? I don't know if you can raise your hand or unmute. Okay, Rebecca, good. All right, see a few hands. Well, we'll go through all that. If you haven't heard of it, hopefully it's something you can save in your phone and help share with others. October is Domestic Violence Awareness Month, so we are trying to get as much information out there. And we've been trying to challenge people to put up resources. If you have a physical space, we have chair ups, posters, all sorts of things. Again, just to get the word out to people. I'm sure you've all seen in the news, we haven't been having a great year so far with intimate partner violence, homicides, and near-death situations. So really trying to get the word out there because we just never know who could use those. So yeah, please feel free to reach out anytime for resources through CT Safe Connect or through myself. My information will be in the chat. All right, so I am going to go ahead and start, but if you have any questions, please don't hesitate to unmute or just interrupt me because obviously this is a little bit of a longer talk, so I'll leave time for questions and everything like that, but please feel free to interrupt or throw it in the chat and I'll try to watch that as we go. All right, so what is domestic violence? Domestic violence is an older term that we, obviously is still used, but we tend to use intimate partner violence more than domestic violence at this point, just because you don't have to necessarily be living in the same home. The difference you would see is if you hear someone saying like family violence, it can be between siblings, things like that. But domestic violence is the pattern of abusive behavior in an intimate relationship where one partner tries to control and dominate the other. The behavior can be coercive or physically or sexually abusive, with the victim often feeling scared, confused, dependent, and insecure. The reason we highlight those words, pattern and control, is just because we want to always remind people that this isn't like someone that just walked down the street and hit you in the face. This is someone who has that built relationship. They understand what you like, what you don't like, what makes you mad, what time you need to be at things, all these different things that they can use to then control the ins and outs of their daily life. So really the biggest fuel behind intimate partner violence is that ability to control someone's life. And many times that leads to this idea of isolation. So whether it be slight at first, like we can all probably think of a friend we've had who's gotten in a new relationship and then they all of a sudden don't, take part in the things that they like to do anymore, start pulling themselves from different situations. Or obviously in more severe situations, we see people like physically moving with someone that they have no connections within that area or moving from other countries. So that ability to kind of isolate someone enough that they don't have those resources, those community programs, can really fuel domestic violence. So I think that's why every single one of you that work in any way with individuals in any programs, like being able to help connect people to know that your programs exist, that is in and of itself something that's going to support someone taking that next step out of that isolation and trying to connect people to different things. Those are the things that will kind of help people feel like they can make that step to address intimate partner violence. So people always ask us, does it have to rise to the level of a crime to call in, or what is a crime in the state of Connecticut? So here in Connecticut, assaulting, threatening, harassing, strangling, or stalking an intimate partner is a crime. So not everything will rise to the level of a crime when it comes to intimate partner violence, but it's really important to know that there are things that do rise to the level of a crime, but it does not have to rise to the level of a crime for someone to seek support. So we really try to encourage people to understand that no matter what form of abuse someone might be enduring, or even if they don't think it's abuse, but they're just like, I don't know that this is healthy because it doesn't feel right. So please reach out and try to connect with our advocates or our local member orgs, because we don't want it to have to rise to the level of a crime. And many times when it comes to intimate partner violence, people don't want to pursue charges against someone because at the end of the day, this is someone that they, have a relationship with and, they have that connection to. So they're trying not to necessarily get them in trouble. They just want that violence to end. So again, I think it's really important to just emphasize that people can start to reach out anytime that they're feeling uncomfortable or unsure about a relationship, or if you as a provider or someone that's supporting someone else want to call and talk to an advocate to talk through things, they're there for you just as much as they're there for anyone else. So please feel free to do any of those things if it is helpful to you. I always just try to walk through like the methods of control. So at the end of the day, our big thing with domestic violence is that it's not one size fits all. So sometimes you might have in your organization an area where you have to do screening for intimate partner violence. And a lot of times people say, well, it's so many questions, why do I have to do this? The reason behind that is because of that intimate partner violence is not one size fits all. So I may never have been hit, but I could have, been sexually abused, and I'm constantly getting my finances taken, things like that. So the reason that there's usually many questions is because of that, and the fact that a lot of times people look at the domestic violence and they think black eye, woman huddled in the corner, like, movies that we see where someone is like physically hurt. But that's not at all the case many times. I always say if you are someone who directly works with individuals, the days that they have those physical abuse signs or symptoms that you can see will be the days that they're canceling those appointments or not going to school or not going to an activity or wearing excessive clothing. So just again, something to keep in mind is that at the end of the day, it's not always going to be something we're going to see easily. So it's something that we can kind of just keep in mind. So we always emphasize the importance of understanding the effects of emotional or psychological abuse. I think pretty much every training I do on this topic, I get several people come up to me after and say, you know what, I never realized like when I was in that abusive situation, I never realized like I was always sick or I was always like, my body just didn't feel right. Like I was so tired and things like that because your body is taking that enormous toll of living in this fight or flight mode. Just like when someone's enduring any form of trauma, like it just kind of takes over the body. So we see that a lot of times most individuals don't even think of their situation as abusive until they're able to look back on that situation. We get a ton of survivors come to us and say, you know, they come to us with this, oh, I've only been abused once. So they tell us the situation where they maybe been physically or sexually abused. But then when they're able to talk through with an advocate, we emphasize, you know, oh, well, was there situations where they would threaten you, belittle you, you know, make you feel like you were less than, all of those different things, and emphasizing that that also is a form of abuse. So that emotional or psychological abuse is many times the root of all of domestic violence. It usually doesn't start with someone just hitting you in the face. It many times like leads up to that. So it's something that's usually kind of like under recognized, but something that you as providers might be able to help people understand or see, because I think the biggest success we can have with people who are enduring intimate partner violence is to show them that abuse outside of the bubble that they think it's in. Because many times we see it as in that moment, this is what happened to me. So this is what is affecting me. But at the end of the day, like what is going on a, like, you know, what can we see outside of that bubble? So how is it affecting my life? How is it affecting my career? How is it affecting my relationship with my friends? All those different things can be really helpful to help people understand. So we don't see it as just this one incident. Because many times that will help people take the opportunity to seek supports, knowing that it's affecting so many other things in their life. We also obviously have physical abuse. Thank you, Evelyn. Their body language can tell you things their words don't. That's a really great point. I don't know if you want to unmute and say anything about that. I don't want to call you out if you just wanted to talk in the chat. But...
No, I just wanted to say that in the chat. Thank you.
Yeah, thanks. But no, that's a great point. And I think that's something that takes, like, that's something really, it's a really good point to point out. And I think we have a lot of people that will tell us like, I know something's up, but they won't say it to me. So that very well will be the case many times. You know, most people aren't walking in there trying to tell you about the intimacies of their relationships. You know, it's just like our society has like become a thing where we don't necessarily think there's anywhere to turn if we have an unhealthy relationship. It's always something we supposedly like deal with once the doors are shut. But it's something that we're trying to get out more. So like, it's great to know that like all of you for listening to this talk and hopefully take those opportunities to call people out and ask, you know, like, are there certain things that have been stressing you out? Or, you know, when those times when your family was so sick, like your kids, yourselves, was it around the times when all these stressful events were happening? So helping people relate back to what stress can actually do to the body, and then helping them to see, because a lot of times people blame themselves. They start to think, oh, I've just become lazy, or I've just become like in a bad mood all the time, or, you know, but being able to help them point out why those things are happening, I think can be really helpful. So thank you. And then physical abuse, obviously, this is the big thing that people think of when we think of domestic violence. So like I said, most people think like we're going to see these glaring injuries and that's how I'm going to know if they're abused. But most abusers, if they are, you know, they have a way that they can make it so that abuse is in areas where it would always be able to be covered up. Or obviously individuals who are enduring abuse work really hard to cover those things up. So wearing excessive clothing, the glasses when you don't need to, things like that, or having injuries that don't necessarily line up with a story that they end up telling you. You can only fall down the stairs so many times. We start to see a lot of these like repetitive stories, but the injuries that are presenting just really don't line up with that. So at the end of the day, you very rarely will actually like see those physical signs of abuse. But if you do, trying to help understand the story as to how they got them. And then if you don't see them, obviously knowing that when you do, there are a lot of things that we can talk through as to how you can work on that. And I'm going to talk through strangulation specifically in a little bit. just because it's one of the biggest things that we see reported through our victim survivors. So it's something we're really trying to get more education out there on. And then, of course, sexual abuse, although they are in a relationship with someone, we still want to emphasize that there can be instances of sexual abuse. I think the most we see is a lot of individuals being forced to have sex when they don't necessarily want to, especially right after having birth, like having people come in with ruptured, like all sorts of things because they were forced to have sex way too early, or being forced to have sex without a condom because if you love me, we don't have to do that. And then unfortunately getting those STIs as a result, or forcing someone to partake in like pornographic videotapes or taking photos so that they can use that against them, all these different things. And then unfortunately, we obviously see situations where people then kind of border into that sex trafficking situation where people are trying to force them to have sex with others. Because we see so many similarities between human trafficking world and the domestic violence world. So hopefully this information that you learned today will help with either situation if you ever have anyone that you interact with that might have questions around any of those things. So I know in the news, we've all been hearing about the Sean P. Diddy Combs whole thing, but you see in that a lot of like, they keep mentioning the fact that he would use the videotapes from these freak offs or whatever they would call them as ammunition against the individuals who would maybe try to come forward and say, I'll blackmail you with these things. So again, just an example of how someone can utilize their power and their control to isolate someone from that ability to seek what we all think should be an option for safety. So, just a recent example that has a lot of ties and pretty much everything to do with intimate partner violence and the isolation that these individuals have endured for a long time, and obviously the human trafficking realm of it too. So just something that, of course, brings to light what people can endure out there around all these different forms of abuse. So, and then technology abuse, we pretty much all have, obviously we're on technology right now doing this. We all have our phones 24/7, and, our lives are many times connected to, I won't say her name in case you have one at your house and I'll set her off. But like having these different forms of technology, like Ring cameras, things like that, where people can control knowing where someone is, what they're doing, when they're doing. It's really easy nowadays for someone to know, where are you, what are you doing, or to basically be tracking someone. If you have kids, we know that like they all have, Snapchat and other apps that have like literally a map of where they are, where their friends are. You can do Find My Friends, you can do all these things to know where people are, what they're doing. And then of course we have social media at our fingertips 24/7, so people know where you are just by your post. And then can also utilize that as a way to diminish what someone is by blowing them up online with all sorts of things that aren't necessarily truthful, or trying to make them appear as something different within the community, things like that. So if you are anyone who works in an organization or anywhere where you do any type of like medical charting or use any type of online medical technology, I think my biggest warning on that is just to understand that this is obviously a form that can be used as technology abuse. So if you do have anyone who's ever disclosed abuse, or if you're working on something like, if you work in mental health, if you work in substance use, you obviously probably know that you have areas of your chart that are safe and secure. So making sure that you clarify those things with your supervisors, and making sure that if you do have a disclosure of abuse, to put those situations in that safe and secure area, because the biggest issue we've been having since the Cures Act passed a few years ago is that, we all go home now from the doctors and we pretty much instantly can see our lab results or whatever it was on our online medical portal. But in situations where we have abusive partners, they can then see that. We've had a lot of victim survivors be found by the fact that their medical portal triggered that they were somewhere because they share accounts with these individuals. So number one, if you do have someone who discloses and you happen to be a person who has that type of privilege of documenting within those, just make sure you know that you have a safe and secure area, and please make sure you're documenting what they're saying in quotations and not assuming what they're meaning, but trying our best to use like safe language, which we have a lot of resources on that if it's ever something that you run into. And again, something you can always call our statewide hotline and ask questions on. But number two is also to ask that person, is this a safe place for us to send a bill? Is this a safe place for us to call you for follow-ups? especially if you work in any type of like reproductive or mental health world, they might not have told that person that they went to those appointments, things like that. So it can be really important to just clarify those things as well, because we many times sign off like who's our emergency contact or who has access to things like years before it actually like we even think about it again. So just reviewing that with people can be really helpful, I think, to help people understand like, you know, what it is that, you know, we have to, like, if we want to make sure that they know, you know, who has access, to what information that they have on there. Then finally, financial abuse. This is pretty much overarching of everything at this point, because it's really the main reason why people stay in abusive relationships. It's hard to afford things even with a partner these days. Never mind thinking about how am I going to separate the finances that I have, that many times people watch. You know, you can see when your checks come in, you can see everything's virtual now. We can see where you're spending, when you're spending. So it's really hard to be able to pull funds, to think about how can I separate that to be able to afford my own house, my insurance, things for my kids, all those things. So finances, again, are probably our biggest request when people are thinking about leaving an abusive relationship. Is, you know, how am I just can't conceptualize how I can do that based off the finances that I have. And we do unfortunately know that a majority of our homeless population is individuals who have endured intimate partner violence. So really trying to make sure that we're helping people with those things. And obviously housing costs, we have a rapid rehousing program. So trying to help support people to at least know that those things exist so they can get on the list and access those options. One that's not listed here, but I always try to mention, especially in light of Jennifer Doulos' birthday had just been the other day, is legal abuse. So we see a lot of people utilizing the legal system. So threatening that they'll call the police because they don't have a status here in the United States, or if you say anything, I'm going to tell them that you're using things like that. So DCF will take your children. I have a higher status than you, things like that. So filing constant motions within the court. I think in Jennifer Doulos' case, she had been summoned like over 50 times to, you know, like in those times when they were getting a divorce, just like keeping people in your life through that legal system or holding that above someone's head is really common as well. And that kind of leads into what came out of Jennifer Doulos' death was Jennifer's Law, which is the concept of coercive control, which we talk a lot about now, because this is also something that you can pursue legally here in the state of Connecticut at this point. It's something that's always been really hard to put into words, because when someone is enduring abuse, they many times are enduring so many things that are maybe not going to be those physical wounds, or not going to be those things that people can like point a finger at, but like to explain how their life has been like just literally sucked into this person's world. So coercive control is that. So it's not just that psychological, but it's a structural control. It's calculated, it's intentional, and it's premeditated. So it places that victim in an objective state of entrapment. And then coercive control diminishes a survivor's ability to exercise autonomy and results in entrapment. So things that we might look at as, you know, if some, like, you know, your significant other says they, you know, hey, that shirt, like, do you like that shirt? I don't know if does it look good? Like, I don't know if it looks good on you, just saying, like, versus like controlling exactly what someone has to wear every single day. So like there's obviously forms of what can lead to coercive control, but some examples of coercive control that we see that people sometimes don't recognize until they kind of look back on situations are, of course, isolation. Like I said, the biggest fuel to domestic violence is that ability to isolate people. So we see people saying, well, why do you need to hang out with your family every week? Or why do you need to hang out with your friends? I love you more. Did anyone here watch the R. Kelly documentary back in the day? Okay.
Yes,
Well,
it
if
was
you,
very disturbing.
yeah. So a lot of what they talked about in that was like, they would even interview like the girls' families and things like that. And they would just talk about how they would always go back because R. Kelly kind of manipulated them to thinking like, well, your family does not love you like I love you. Like no one loves you like I love you. No one treats you like I do. Look what I give you. Look what I do for you. So again, just kind of a manipulating, using that, like that kind of like purposeful like language to make people feel like, you know, this is what's right and this is what this person, you know, this person does love me the most, or things like that. But what it's doing is isolating people from the things that do support them, or the resources that are helpful. Like many of you who might work in mental health or things like that, when you're trying to get through when someone's dealing with so much trauma, but people just feel like, I don't trust that, you're not the one I trust, so why would I listen to you, type of thing. So again, just like coercive control is really that ability to like purposefully make someone feel as though they are something that they're not. We see intimidation a lot, so making them feel afraid by looks or gestures. I know we've had a few survivors say that their abuser would put one bullet on the table every day, just as a reminder that I have this ability. And we have others who said, well, every time I knew he cracked his knuckles, he was mad. Like someone else might not even notice that, but I knew like I need to get out of there because these were things that I subtly know, and something that puts me into this stress situation that maybe others wouldn't necessarily notice. Using coercion and threats, we see a lot of the times, if you leave me, I'm going to kill myself, or if you leave me, I'm going to take the kids, I'll kill our pet, I'll do, whatever it takes, because I can't stand my life without you. So we see a lot of that, like really guilting people into this feeling that they're going to hurt themselves, or I'll go back to using if you do this, like I can't do this alone, those type of things. So really putting basically a whole life on someone's shoulder, feeling like it's up to them to make this person, to be there to support that person. We see children, so especially when they're enduring abuse, enduring like divorces, things like that, we see a lot of times they'll buy them like technology that has like spyware on it, or we'll set up the old cameras that are in the house so that they still have access, things like that. Or use the children as a way to say, well, I would be home if dad would let me, or I would be home if mom would have let me. But they're the reason that we're all separated. So kind of pinning people against each other and using them kind of as a weapon in a sense, to make people feel bad about the situation. And of course, we know that of course it hurts the children in the ways that we see like the ACE scores, knowing that they're feeling these feelings, these adult feelings that they shouldn't have to necessarily be dealing with, because that person is putting that blame on them or that pressure on them. And then damaging people's relationships. So we see that through social media, or through like going to people's jobs, telling them they're liars, or trying to use their own status to say, well, they're just crazy because they have mental health issues, or they're using again, or things like that. So trying to pin people against each other when that's not necessarily what that person is or does. And then minimizing or blaming, we see it all the time. So saying things like, oh, I wouldn't have had to do that if you would have just done what I asked you to do, or I didn't even hit you that hard, like just chill out. Like you've seen people on the news, it's been way worse. So minimizing like the effect of what their actions are, or this is not as bad as what like my dad did to my mom, things like that. So just using other people's situations to kind of minimize what they're doing, or denying that ability to take that blame. Obviously, we see a lot of possessiveness and jealousy. So if you're someone that works in any type of care setting where you see people coming in with their partners, you might see people who are constantly answering for them, or making sure that they know that, like, whatever you do, what are you doing? Like, I need to know where you are, when you are, like, if you are not home within an hour, you're cheating on me, things like that. I especially always tell this to younger adults, is when, you're growing up, you don't know that, hey, extreme jealousy is not love. That's not love. It might seem like it, like, oh, they really care for me, and that's why they're jealous. But at the end of the day, that is not love. And making sure to emphasize that when you start to see those extreme levels of jealousy, we especially see it when individuals have appointments with maybe some of the organizations that you work with, and then I have to go, I have to be home by a certain time. When you're always on the clock, when you're always kind of stressing as to, like, if I have a random phone number in my phone, what are they going to think? All those different things. So really trying to kind of understand when we're seeing those situations of extreme jealousy. And then, of course, controlling, so not giving enough money for groceries or rent, or being the person who has all of the funds, like controlling all the funds. So you can only get your, like, quote unquote allowance when I allow you to. So again, making it really hard to conceptualize, how can I leave this abusive relationship if I kind of rely on that individual? So there's a lot that goes into coercive control. And again, like I said, coercive control at the start can just be simple things that maybe are not going to lead to these higher level of things like isolation, intimidation, jealousy, things like that. But that's why we really want to like catch it from the start to say, you know, hey, these things aren't healthy. And, you know, how can we, like, is this making you feel stressed? All of these different things to help people recognize when things are kind of starting to spiral in that direction. Does anyone have any questions on coercive control? Or comments?
Ashley, I think sometimes we've seen where folks who are accessing treatment, well, especially folks that are in early recovery, where a partner will try to coerce them to leave treatment. And I know that's been something that has come up a bit, where folks are leaving AMA or sort of cycling through coming in and out of treatment.
Yeah, thanks, Shelley. That's a really good point. And actually something that we have been hearing a lot about is people saying like, well, they told me I don't need that. They'll take care of me, or almost using it as a way to then say, well, they didn't finish that program, or they didn't take those services. So that's a really good point. We see that in substance use treatment. We see that with any type of medications or resources, is people trying to say, you know, they don't need that, but then at the end of the day, they're going to hold that against them when, you know, it's going to look negative to others that they weren't able to get those things done. So thank you, Shelley. That's a really good point. Anyone else? Okay. All right. So we always get the question of why does someone stay in these relationships if this is the case? And so what we want to do is try to take that out of people's vocabulary. We want to remember at the end of the day, we don't want to further punish someone who's being abused by asking, well, why are you staying? You know, we've all probably had a friend or a family member where we're just frustrated because we're wondering like, hey, I've given you advice. I've told you this person's not good. Like, why aren't you leaving? So the things that we have to think about is at the end of the day, if it was as easy as just wiping our hands clean of everything to do with this person, we all would. But if you think about even the shortest relationship you were in, it's not just as easy as like, hey, I'm done with you. It's, you know, you have friends in common, you have areas of the you know, neighborhood or things that you do that might intertwine, or you have, you know, obviously if you're in a longer relationship, you have kids in common or houses. Like, it's not as easy as just like breaking free. So what we want to do is, instead of asking, you know, why aren't you leaving, is, you know, what can we do to help support you? I think the biggest thing with domestic violence is that it's many times put to the bottom of the barrel of things that we think we can change. So what we think about being able to change first is, hey, I need to know where my next meal is coming from. I need to know housing. I need to know what my kids have for supports. All of those things seem like things that are more important than addressing something that feels so far out of reach as to an ability to change it, because the innate nature of domestic violence is that it changes every single day. It's not always bad. Like, someone at the end of the day, remember, like, this is someone who was, you know, their soulmate, or their, you know, someone that was charming to them. So there's all those good days that lead you to think, okay, it's going to be okay. And it's really hard to conceptualize, you know, all the different things that you would have to do to leave that. When they pull these things like, well, if you leave me, I'll kill myself, or if you leave me, like, I'll go back to using, or, you know, I'll tell them that you're using, things like that. So instead of asking why don't they leave, I'm trying to ask, what can we do to support them? So the number one reason that we see people not leaving abusive relationships is that fear of being hurt or killed. And this is a legitimate concern, because we know that the number one reason why why we see homicides within inter-partner violence is when someone's in the act of leaving an abusive relationship. So you pretty much every homicide we've seen pretty much this year, you'll see in the news like they were just broken up, or they were going through a messy divorce, things like that. So again, it's that ability to control someone for so long, and then when they say, no, I'm leaving, they kind of lash out at every single thing around them. So when we hear something about an abusive relationship and we think it's safest to say, you know, I'll call the police for you, or I'll make this plan for you, that's really what's not going to be safest for that person, because they most likely didn't come in that day with their bags packed with their medication, their kids, everything that they would need to not have to re-enter that home with that abuser, or re-enter that lifestyle with that abuser. So making sure that we can help them create a safe plan, so that if they are looking to leave, that they have that safe option, that they have restraining orders, that they have their things packed that they would need to be able to safely leave those situations. So I think our biggest take home with domestic violence is trying not to pull the rug up from under people, even though it seems like it's urgent in the moment. but being able to help connect them to local member orgs to help create that safety plan, if it means going to a safe house or if it means just creating a plan where they're going to be able to gather things over a few months. Because we don't want to put people in situations where they are trying to flee that relationship and then that person is really infuriated at them. And then obviously love. At the end of the day, we're all human. We want to see the best in people. So even if we have a fight with someone, we think, they usually apologize. They say, I'm so sorry. I'll never do it again. Sometimes they'll buy people things. They call it like this honeymoon phase where you want to see that person that you saw from the start, that person that was, so loving and caring to you and was your soulmate. You'll say, well, maybe they're just having a bad day, or maybe they're right. Maybe it was something that I did. So we do see people return to abusive relationships about 5 to 7 times before they actually leave an abusive relationship. And that's the innate nature of domestic violence, is that at the end of the day, that person on the other end of that abuse has the ability to say sorry, or to act nice for a few days, or to say they'll never do it again, things like that. And you want to believe them. You're human, and you want to help support someone, especially if they might be going through substance treatment, or they're going through a really tough time with their family. Well, maybe it's just because of that. And I want to support them. I don't want harm to them. I just want this violence to stop. So we do see that people will return about 5 to 7 times before they leave an abusive relationship. And then, of course, children, money, like we talked about, limited to no support system. So again, that isolation of, I don't know anyone around here. I don't know any programs. I don't know where to turn. And then it might just be safer at that point in time for them to stay. It seems like a weird concept, knowing that, you want to help get them out of these things. But a lot of people say, I feel safer if I have an eye on this person, especially when they're around my kids or my pet. But I know how to control what's going on in that home. And that's where I feel safest. I'd rather not know where they are. So again, just listening to victim survivors is the best thing we can do, and then helping them connect with an advocate to hopefully create that safety plan around those situations. And then, of course, trauma. We know, obviously, you all know how much it affects the way that victims approach potentially helpful relationships, and compounding those issues of isolation. So we see a lot of times people will call us and, I'm so frustrated. I've been giving resources and they just don't want, they seem like combative. They don't want to, understand it. They won't take the resources. But I promise you, the more you continue to offer them these resources to understand that these are things that are common, that this is not just you that's going through these things, the more you can remind them that these resources are there, they'll take that opportunity when they find the time to do it safely, or when they are in a place that is where their brain can kind of conceptualize how to move into that situation. So knowing that trauma affects so much of what people do and how they see the world. So really trying to make sure that we are remembering that there's always going to be trauma when it comes to intimate partner violence. So the actions that they might show towards you might seem abrasive or things like that, but the more we continue to at least reiterate these resources, they will take you up on those opportunities. And this was a resource that was developed by a pediatric doctor in Pennsylvania, but I just wanted to put this as another way to help emphasize, because I think a lot of times when we're working with patients, clients, or anyone in our life, we're thinking, well, why didn't you come to an appointment, or why, you're not doing what we're trying to tell you will help you. You're not coming to these appointments, or you're not doing these things. But at the end of the day, there's always a why. There's always a reason why someone might not be able to. And sometimes when someone might be in an abusive relationship, there are a lot of things that they're dealing with behind the scenes that might seem neglectful to us on paper, but to them, it's just, this is how they're surviving. I always, especially when we talk with OBGYNs, I always say, especially for someone who's been sexually abused, you might think that they're just being neglectful and they're not coming to these appointments, but it might be extremely traumatic for them to be coming into those pregnancy appointments or any type of pelvic exams because they don't even maybe think it's going to re-trigger memories that they had, but it does. So just trying to make sure that we're understanding what can we do to help someone be more comfortable and to help them get to the situations that we would like them to get to seek supports or services, whether it be for substance use treatment or mental health supports, things like that. We do see within intimate partner violence, we see a lot of withholding transportation, manipulating appointments, so calling for them and trying to change them. We see a lot of controlling medications and the decisions like Shelley talked about, pulling people from treatment. We see this a lot with birth control, or Plan B, or ability to get abortions. People trying to control the outcome of what this person wants from their care, or telling them that you're crazy, like you don't have this pain, or you don't have this or that, like you don't need that. And then, of course, not allowing them to speak during appointments when you have someone who's just trying to control the narrative, or especially if you have someone who says, you know, I'll be the interpreter for you, but is maybe not even relaying what that person said. We've had a lot of survivors tell us, you know, I never knew that they were what they were telling my doctor. They just said they would interpret for me, and I thought they were relaying what I was saying. And when I finally was able to read my chart and things like that, it was not at all what I was trying to say. So really trying to take over people's narrative for them. It might seem like, oh, they're just helping them, but that's why we always do try to reiterate helping people to have those 5 minutes alone with you once in a while, or just have those opportunities to speak for themselves, because we never know, you know, what might be going on between that relationship. I'll talk about stalking more in a minute, but of course we do see people aligning with people of power. So aligning themselves if they're a police officer, or if they are a medical provider, or someone that has some type of control or power in the world, that they are revolving around, that they can utilize a person to say, well, I'm gonna, you know, they like me better than you, that type of thing. And then, of course, discrediting survivors. So saying that they're crazy because of their substance use that they have, or their mental health conditions that they have, trying to say, well, they're crazy, don't listen to them. Like, that's just their illness talking. So trying to make sure that we're not letting people, you know, paint this image of someone that is untrue. And then, of course, we see the charming, that manipulation. Pretty much every time you see a homicide in the news, you'll notice that neighbors will say, oh my gosh, they were such a nice couple, or this person was so nice, I would never have expected that of them. Because that's the art of manipulation, is that you can put on a face for others that appears to be something that it's not. You can, and that's probably how we get into situations of domestic violence in the first place, is that ability to use that manipulation, that charm, to say, you know, this isn't my fault. This is, you know, these people like me better than them, that type of thing. So that is like a really big key for someone to be able to control and dominate not only that person, but the people around them as well. So at the end of the day, like I said before, most victims don't actually want the relationship to end. They just want that violence to stop. So I know a lot of us think, you know, the best thing for someone is to get them out of these abusive relationships, but many times the reason why people return is that they really just want to see that person that they saw from the start. So it is really hard, especially at the start, to think of, why would I just like drop and leave this person when they are promising to change? Or, you know, I just want to see that person I saw at the start. Like, they're a good father, they're good, you know, like they're good at what they do, they had a rough life. I just want them to stop being violent. So we do see that a lot as the reason why, as a reason that people will give, and it's a valid, you know, thing that we can understand, that, you know, you want to see that person you used to see, but after a while it just comes a point where that person is not who you thought they were. I know it's a lot of me talking, so please feel free to interrupt, and hopefully people will kind of chime in as we go through this next part, with any like experiences that you might have had. But the reason that I come out and talk with anyone who is working with individuals within substance use trauma work, and within healthcare, of course, is that we know that individuals who are presenting to the care settings that you guys work in usually have a much higher rate of intimate partner violence, and are seeking those secondary supports as a result of that trauma that they've endured, whether it has been from abuse in the past or present. So we have great opportunities in every program that we are touching people's lives, where we're interacting with anyone at any point in the day. We have an opportunity to let them know about a resource that they might otherwise not have known about. So for anyone on this call who didn't know what CT Safe Connect was prior to this training, your patients, your clients, people are in the same situation. They don't know that these things exist. So how can we help people understand that? And I think, you know, knowing that people come into, you know, see you once in a while, or, you know, on a regular basis, these are all great opportunities to just at least let people know that these resources exist. And of course, we know that October is Domestic Violence Awareness Month. It's also Breast Cancer Awareness Month. And I just always try to emphasize that, you know, we're constantly asked about making sure we're checking our breast health, making sure that we're keeping an eye on all those different things. But I think this is a really powerful statistic from Futures Without Violence, is that abuse is more common for women in the United States than breast cancer and diabetes combined. And these are things that we hear about so commonly. We're constantly told, eat healthy, making sure you're trying to keep a healthy lifestyle. If you have diabetes in your family, we know that there's a lot of people we know that have that, or we unfortunately know a lot of people with breast cancer as well. But to know that there's this hidden thing of domestic violence, behind closed doors, it is unfortunately more common than breast cancer and diabetes combined. So I've been trying to challenge people, especially during Domestic Violence Awareness Month, to at least let people know these resources exist and help people understand that there are kind of opportunities for people to reach out if they ever have questions. And so what I always emphasize with people is, at the end of the day, most people are not walking into anyone and saying, hey, I'm abused, can you help me? That's usually something that people keep as a pretty quiet thing that they think they have to deal with themselves. But what we see a lot of the times is people presenting for things that they think they can change. So because of the constant walking on eggshells, because people are living in this like fight or flight mode on pretty consistent basis, we see all these secondary concerns coming forward within themselves, within their kids, when that violence is worse within the home. So I think that's really important to kind of emphasize and think about, is that you might be seeing people who are coming in and you can't really figure out why they're always having like these complaints, or certain times of year they're always having certain things that come up specifically, or obviously not saying if anyone has any of these things on the list that they are abused, but these are really easy ways to help people connect, again, seeing violence outside of that bubble. So I think, like I said, when I do these trainings, I get a lot of people that will say, well, I never realized I was always so sick when I was in these abusive situations, or I had such bad headaches or things like that around the time when those things were worse. So we do see a lot of course, like PTSD type situations, depression. We see a lot of flare-ups in like asthma, especially in kids and adults, when those stressful times in the home are worse. We see a lot of that compromised immune system, so always being sick, because again, when your body's always in a stressful situation, it's reacting in a way that is trying to help, but is making us, sick. So I think that's really important to kind of emphasize. I think it kind of came to the forefront during COVID, when you probably saw in the news like intimate partner violence increased during COVID and all these things. But to be honest, intimate partner violence is always there. It's just when we were all kind of locked into our own homes and we had no other way out, and we had no understanding of what was going to be happening next. Like, it was in a sense of what it's like to live in a home. Like, most of us go home and that's our safe place. It's where we're happy. But for those who are enduring domestic violence, when they have to go home and that's the only place that they can then be, like during COVID, it really highlights that need for people to be able to be removed from isolation, to be able to go out and get supports and things like that. So it's always unfortunately been there. We've just always had that outlet to be able to leave and go to activities or go to different things. So I think really important, again, to understand like how much that type of isolation kind of play a role in all of these different things. And we also see a lot of increases in GI issues around intimate partner violence. Pretty much anything, any like health concern, you can Google it with intimate partner violence, and you'll see like when someone discloses that they've been abused, you have a much higher rate of heart disease, all these different things as a result of that abuse. And then we, of course, see pregnancy challenges, which I'll talk through. I talked about the sexually transmitted infections. Hey, if you love me, we don't have to wear a condom, things like that, or manipulating their birth control. And then, of course, we see an extremely high correlation between substance use and intimate partner violence. So whether it has been from a previous abuse that they then turn to substances as a way to cope, or that actual abuser got them on the substances that they are on. So we do unfortunately see a really high rate. So I think, especially in the role that many of you have, such a great opportunity to bring up both topics and help people, parcel out where, what came from what, and how we can help support that individual that might not have been able to like conceptualize how that trauma has led to the certain things that go on within their life, or the relationships that they're in, and especially great resources to be able to providing within substance use treatments, because we know that there's such a high rate. So we do have obviously all sorts of posters, tear off things that you can easily throw in there, and then they can take those at their own accord. The big four, though, that I do want to emphasize, so if you remember nothing from my talk, if you can just keep these in mind as big red flags. So if you are currently working with anyone that comes under any of these topics, making sure that we understand that these are really high risk situations. So number one, pregnancy, and I'll talk a lot more about that. We see an increase in intimate partner violence when someone is pregnant up until the child is 18 months. So really important time to emphasize that resources are available and get people to understand that they are out there. And then the 3 S's. So we have stalking, strangulation, and separation. So stalking is pretty self-explanatory. If someone is saying to you that they are constantly being followed or they're being stalked online, those are all really dangerous situations that person's kind of like lost control for their own life. So really making sure that they're helping people to know that that is a crime in the state of Connecticut, and they can seek supports around that. And then of course, strangulation is a big one, and I'm going to talk a little bit more about that today. It's kind of a passion project of mine, is really emphasizing the importance of getting people supports around choking and strangulation, because it is so lethal. And then of course, separation. Like I said, that separation is really, really important to understand. If someone has just disclosed to you that they are leaving an abusive relationship or they are going through a messy divorce, those are really high risk situations. Those are where we see the highest rates of homicide. So all situations where we really, really want to make sure that we're getting those resources into people's hands. All right, so today I just wanted to do a little bit deeper dive into, like I said, those 4 big topics. So I'm just going to talk a little bit about strangulation. So I'm sorry if this is not a topic that people like usually want to listen to, but I think it's always really important because I think once you hear about it, you get really invested in the idea of how important it is to understand, because it unfortunately is one of the highest answers that we get on the lethality assessments that we do here in the state of Connecticut. When someone is in an abusive relationship and a domestic is called, the police officers do what's called a lethality assessment. And one of the top answers that we get is that someone has been choked. We say choked because that's what people relate to, but what it actually is being strangled. So according to the emergency medicine studies within that journal, women who've survived strangulation have a 750% increased risk of being the victim of domestic violence homicide. So it is a very lethal situation. The Strangulation Institute is an amazing institute. If you're ever interested in this topic, they have their next, academy in March. You can sign up online. But they have such great resources on their website and really easy to just throw up in a room that might have people that might encounter things like this. So if you ever have someone who's disclosed that they have been strangled, this is a good resource. We also have it. They also have it online in Spanish now, and they have it with darker skin, so you can see the signs and symptoms. But something about strangulation is that it's not always going to show. There's not always going to be this like very glaring hand mark on people's necks. But if you do have someone who disclosed that they have been choked, or if you are suspecting that, things you can look for are, the biggest thing you'll definitely know is strangulation is you'll start to see, it's called petechia. So it's like little red dots under the eyes, and it would be unblanched. So it's like freckles it's like freckles. They don't go away. So they'd be under the eyes. You can see them if they pull down their lip, in their lip or behind their ears many times. We obviously see this in kids and adults. Or again, that very, very red bloodshot eye from that oxygen being cut off, or if you see changes in people's voice, all of those different things can be a result of strangulation. So this kind of just shows a good way to recognize certain things about strangulation that you might be able to pinpoint. And then this is my favorite resource. Again, I know it's very nerdy, but like this is my favorite resource around strangulation because I think it can help people really understand why strangulation is so important to talk about. So if you have anyone who's disclosed that they've been strangled, please let them know, what that actually meant. And if it's something that was recent, to ask them, if they're comfortable to go to the ED and get a neck up checkup. What they can do is they can do a CT scan just to make sure there's no blockages. We see a lot of people having strokes later on, weeks, months later, because of that occlusion to what they had on their arteries. And what I'm talking about is not a lot of pressure. Like it takes less pressure than it takes to open a can of Coke. I mean, we've all opened a can of Coke. And that's how much pressure it takes to do what this says here. So in less than 6 seconds, you lose consciousness. So someone has no idea what's gone on after that point. So that's the innate nature of strangulation, is that most people say, oh, I don't know what happened. Never mind, let's just move on. But you can see how quickly someone can lose their life in just over a minute. We see that death can occur. But big things for you as someone who is working with individuals, if you have someone who has been strangled, the big keys to it are asking, did you lose control of your bodily functions? So you can see at 15 seconds, you would lose control of your bladder. So at that point, if someone says, well, yeah, now that you say that, like, no one's just going to come out and say, hey, I peed my pants. Is that part of strangulation? So you kind of have to be the one to bring that up. But you can, if they say that, that proves intent, because no person is just, losing control of their bodily functions while they're, they say, quote unquote, we're just blacked out for a second. So it proves intent that that person was being strangled. And then of course we always ask, what was the look in their eye, things like that. What do you remember before you lost consciousness? But my biggest take home with strangulation is, of course, that because people don't remember what happened, because they don't know, they just think, okay, we'll just move on. And we see people going through strangulation after strangulation, but the amount of oxygen they're losing to their brain, like how quickly they can lose their life, is so serious. And we see so many people feeling like, I feel like I'm dumb now, or I don't remember things, and blaming themselves for a lot of things that are a definite result of that brain injury, that strangulation that they've endured as a part of that abuse. So something that can be really helpful, I think, within your work, if you do ever have someone who's disclosed strangulation, to kind of help them understand, again, outside of that bubble, like, what does it actually mean? Like, how close are you actually to death? Because we know if it's happened once, it's going to happen again. So just an important topic. And like I said, the Strangulation Institute is a really great resource. If you ever have questions on it, I really encourage you to check out their work. It's really good. Does anyone have questions or like experiences with strangulation situations?
Yeah, this is Rosemary. I do have a comment about that. We admitted somebody here at our program. I work with women and children, and she went through that situation. She was strangled by her partner, and then she called, 911. The paramedics came in, and then she was saying that the concern the police had was like asking questions about how was that a strangulation, but since they saw that she was somewhat breathing okay, kind of, you okay, you're breathing, so kind of left her. Did not do any follow-up. She was going like, she said that she was so confused, even to understand what, and so the lack of understanding and probably the education in regards to, for these people were the first person to come to the scene, and then treat the situation like that was pretty traumatic as well, you know what I mean? So she was just telling me, and the way she was saying, she said, oh my gosh, and that was a comment that she made, that she was pretty much left there.
Thank you for sharing. That's so true. It's like one of the most terrifying things about like the Strangulation Institute's training is they start the training with a call to 911, a recorded call that someone there, you can clearly hear them like gasping for breath, and they are just yelling, stop, you're fine, you have asthma, you're fine, get your inhaler. She's like, no, like she's trying to explain, and they literally just like kind of left this person. So you can see how easily that can happen, where we have this lack of education of what strangulation is, or they're just overreacting, they're hyperventilating because they can't breathe. And so thank you for sharing that. That's terrible that that person had to go through that. But again, why we're trying really hard with police officers, with EMTs, with anyone, to make sure that they're understanding the education. And then also with anyone who's endured strangulation, to know that you have the right to go to the ED, and the Office of Victims of Crime can help support that if there ever was a charge for it or anything like that. But to get those neck up checkups, because you're not wrong, like you did endure that trauma, and you should be listened to. So it is really sad when we hear those situations where they weren't. So thank you for sharing that. We did do, I don't know if any of you took part in our training series last year. We did at CCADV. It's like a simulation series that they have at Hartford Hospital. So they have live actors, and we did it with strangulation. It was so interesting to see, like, first of all, the number of times that victims and survivors are asked the same question. So like a doctor, like the EMTs come in, and the doctors come in, and then the police come in, and you see why people start to recant and say, I gotta go home, like I can't. And like, it was just very interesting to see why, how easily someone can just be convinced, like, oh, I'm just crazy, like this, nothing happened, I'm fine, like I'm just gonna get out of here. So yeah, thank you for sharing that. That's a really, really good point. All right, so then so obviously just kind of jumping around to the others of those big four is, obviously most of our work here at the Connecticut Coalition Against Domestic Violence. We have a maternal mortality due to intimate partner violence grant. But it's a big passion project of mine as well, is just like understanding that at the end of the day, if someone is pregnant or has young kids, like trying to let them know that these resources exist, because even having a baby with your, quote unquote, perfect partner is really hard. Like it's very hard to like raise children. They're a lot. So never mind if you didn't necessarily mean to have a child with that person, or if you don't have the perfect relationship. So we do unfortunately see, especially in young girls, a lot higher risk of becoming pregnant. And then obviously we do unfortunately know that 1 in 6 women have been first abused during pregnancy. And then we have obviously glaring problems here in the state of Connecticut, just like we do across the world. I know you've all heard on the news how terrible our country is at maternal mortality. And of course, glaringly within that Black non-Hispanic population, we have a glaring glitch, but we also have that here in Connecticut. So this was just from the PRAMS data that the Department of Public Health has. But looking at violence during pregnancy and how we saw that it has higher among those non-Hispanic, Black Hispanic birthing persons. So 4 times higher. So of course, something that we want to keep in mind. And just like everything around maternal mortality, we see it higher amongst the Hispanic and non-Hispanic Black population. So again, really trying to emphasize the need to create more trauma-informed resources around these particular areas. And then through our maternal mortality grant, this is particular just to point out like why I feel like we talk about this so much at our office is because so we looked at every single person that's lost their life due to maternal mortality. So anyone who was pregnant or up to 1 year postpartum, if they lost their life for any reason during that time, we look at that obviously every single year with our maternal mortality group. But what we did is we looked at all 102 of those individuals that lost their life. And of those 102 individuals that lost their life, 33 of those had lifetime IPV. And unfortunately, only 1 of those individuals was referred to IPV services. And 3 of those individuals were directly homicide victims. So it's just really important to see like, you know, what our eyes don't necessarily always see. These are all such important resources, especially around that time of pregnancy, is to give these resources around you know, substance use resources, mental health resources, intimate partner violence. So at the end of the day, for any of you that are on maternal mortality with me, like we know that there's very few that are actually like medical issue deaths. Like many of them are the substance use, the suicides, and the intimate partner violence. So really trying to bring that forward as if we're going to make any changes within maternal mortality, we have to address those things. So of course, again, you can see here, these were the individuals that have lost their life during pregnancy or up to 1 year postpartum. But what we can see is that there was the interconnection between that lifetime IPV and then an increased use of substance use disorders, mental health conditions, and then of course ACEs. So we always say like your original ACE is when you are in utero, because if you're enduring that stress of domestic violence or if you are enduring substance use, all those things, these are all things that are going to affect that individual moving forward. So you can see, obviously, there's a pretty big increase when someone has that violence in their life of all those things. So again, just a reason why we think, you know, what all of us do is work that we can all kind of work on together, knowing that there's never just one thing that someone is trying to work on. And then, of course, not just with the maternal mortality data, but also with individuals who live through their pregnancies and do what's called the PRAMS survey every year. We see that there's obviously a massive increase in the comorbid anxiety and depression. It was 3 times higher among those who experienced violence during pregnancy. So those are people who self-disclosed that they were abused during pregnancy. And then obviously we correlated it with the anxiety and depression scales that they were also asked about. So just see like such a high increase in that when we talk about someone who's lived through that violence. And then I do always just try to emphasize quickly, like before and during pregnancy, we see those stressful life events that we talked about. So being much higher among those who have experienced violence during pregnancy. So again, you know, what are the reasons as to why we see people having these like low birth weight babies or preterm births or going back to substances or having these like quote unquote mental health breakdowns. So we see a lot of like increases in those stressful things that they're dealing with behind the scenes. So it's not just like, hey, I was hit or something like that, but again, more of these like arguments, problems, paying bills. So that stress around where are we going to be living? Where are we going to get our next meal? Someone cutting their pay or controlling their play. Someone close to them has a drinking or a drug issue. Parents didn't want that, the partner didn't want the pregnancy. We see that a lot. And then of course, separation, divorce. So a lot of things that go into it. So pretty much every aspect of what we all do, it's always all correlating into, all of the work that we do is always so intertwined. So I think it's just so helpful to know what each of us do to be able to help in those situations, to know like we can help someone maybe connect to a resource around their substance use, or we can help them connect with something like WIC to help kind of relieve those stressful situations that they might be enduring. All right, so I'll try to go wrap up and talk about the resources that we have here in the state of Connecticut. So if any of you have ever reached out to our member organizations, these are all of our 18 member organizations across the state. So if you're not familiar with your local member org, I really encourage you to get to know them, especially during October, because it's Domestic Violence Awareness Month, and a lot of them have a lot of great activities, which I'll have a link for at the end as well, that you can hopefully, maybe get to know them. Or like I said, all of our resources kind of intertwine so much that we can always use each other. They're always looking to understand better what programs are in their resource areas, as well as, vice versa. So I always do emphasize that they are much more than just safe houses. We try really hard to ensure that people can stay within the lives that they have. So I think a lot of times we think that, going to shelter is the only answer when it comes to intimate partner violence resources. But obviously with the limited funding that people have and the ability to keep people safe, if they have an option to stay with a friend, or if they can take resources that would allow for lock changes or restraining orders, they have people that can work on all of those different things. Our safe houses, I think, are currently about 156% capacity, or 146% capacity across all 18 of our member orgs at this point. And that includes, we do have some people in hotels as well, obviously, to deal with that overflow. So we really are trying our best to help ensure that people can get safe resources with friends or family, or if they really need to come to a safe house, which obviously is traumatic in and of itself. And some people, I think that's the only resource there is. So they're like, I'm not going to call. I don't want to go to a safe house. So just knowing that there are a lot more resources than just that. There's a lot of community supports. They can walk in and go to counseling. They can go to support groups. They have that for men, women, children. They have resources around rapid rehousing for people fleeing domestic violence, sexual violence, or human trafficking. And it's not necessarily instant, obviously, like anything in housing, but it's much better than the 10-year wait list you're going to be on with Section 8. So if you have someone who is enduring that, they have to connect with our local member orgs and then kind of work with them on that list. And then, of course, I always emphasize we have court advocates in every single one of the courts. So I think the biggest thing, and the reason we get most individuals that even understand that our service exists, is unfortunately that they've already had to deal with the court. So when there's a domestic in the state of Connecticut, one person does have to be arrested. We're a dominant aggressor state at this point. So the police officers have to identify who the dominant aggressor is and then who the victim survivor is. They're supposed to administer a lethality assessment to the person who's the victim survivor and connect them to our member orgs. And either way, that both individuals do have to be arraigned that next morning. So either virtually or in person, that person's kind of thrown into the situation where, like, I don't know what's going on. Like, I didn't necessarily want them to get arrested. I just wanted the violence to stop. So it can be really traumatic, but knowing that there's court advocates there, so helping them connect and getting to know the court advocates, they can stand up there with them, for them, and kind of help support them as they go through the processes that they're going to have to go through, I think can be really helpful, because again, that's the biggest reason we get people to know that our service exists, unfortunately, is when a domestic is called, whether by a neighbor or themselves, and being involved in that court system through that. So we do have court advocates in every single one of the courts. And then obviously we have our education services. So we have community educators or like our health professional outreach group who can come out. We can give CMEs, CEUs for anything that might be helpful to help people understand how they can put resources within their care settings. And then, of course, our statewide hotline. So how you can reach our 18 member organizations instead of getting out a map and looking at all their numbers. You can call CT State Connect. It's free, it's confidential, it's voluntary. You can text, live chat, or email or call. So if you wanted to take a picture or save it, if you don't already have it in your phone, it can be helpful if you're just out at a bar or if you have a friend, or obviously if you have clients or patients that might be able to utilize that resource. It can just be a good way for people to get that information. And of course, for you as providers, if you're ever unsure, you're uneasy about a situation and you just want supports, like, what do I do in this situation? Or I feel like I need to know how to document this, or I want more tariffs for my office. Call Safe Connect. They're there for you just as much as they're there for anyone else. So please, and advocate and continue to advocate. If you don't feel like you're getting where you want to, you know, there's always managers on, and you can always try to connect with a different advocate, things like that. Okay. So how can you guys help after listening to me talk for an hour here? So basically what we talk about with everyone, no matter what area of work you are in, if you're interacting with anyone at any time, like, the best thing we can do is just let people know that these resources exist, because if someone knows that there's maybe somewhere they can turn other than the police or things like that, then they might take that opportunity to at least reach out and test it out and see what it's like when those bad days do come. So what we follow here in the state of Connecticut is called CUES. And again, this is through Futures Without Violence. They're an amazing resource for all things IPV and human trafficking. But the basic idea behind CUES, and you don't have to remember this acronym per se, but is that you can just get education into everyone's hands. So instead of us just whipping through bunches of questions or ignoring the topic altogether, like, how can we give someone a resource that we know is interacting with us on a consistent basis, or even just once? You know, how can we get the opportunity to get that resource into someone's hand? And yeah, so if you screen or if you don't, like, my preference is not to tell you, like, you have to screen or you don't. That's always up to your organization based off of, like, what they're following. But at the end of the day, what we are encouraging is, no matter if you screen or not, is that we want to make sure that we are letting people know what resources exist. Because at the end of the day, like, if we're screened for IPV, like, have any of you been screened for IPV when you've gone to a doctor's appointment? Hopefully. Okay, good. I see some nods. So, like,
And I
mostly
did
that.
tell someone, Ashley, the other day when I wasn't screened, I was like, usually you
good.
screen me. Why aren't you screening me?
Thank you, Rebecca. And then they red flag you. No, just kidding. No, but it's, so we, you know, many times if we are getting screened, if, you know, you're going to OB, like, that tends to be where we'll get it. But, you know, so if your organization is screening, that's great. And we encourage you to continue to screen. But what the resources that we try to instill is that no matter if you screen or if you don't, if we can just get education into everyone's hand, that's really the best thing that we can do to help support people know what resources are out there. Because again, pretty much everyone you see every single day is either in a relationship, was in a relationship, or will be, or has a friend. So it's something that they can use either in their life with someone that they know or with themselves at some point. So what we emphasize is that if you are an organization that is screening, please try your best to separate that individual if they have partners at home or with them at the appointments, saying, hey, we're just doing our intake questions with the people for the first 5 minutes, and then we'll come grab you as soon as we can. If they happen to be someone who has their kids with them, if they're over 3 years old, we try to say, like, try to be discreet in how you're saying it, or if they have headphones, or if they can be distracted for a minute or two, just because we do start to see people, kids will parrot back what they hear at those appointments. So trying to be thoughtful of that as well. So screening is not always going to be the safest situation, and you can judge that based off of the situation you're in. If someone absolutely will not separate from their partner, things like that. And that's where that education can really come in handy, because if you can't safely screen, you can still always give a resource. But trying our best to separate people so they have the opportunity to have those 5 minutes alone can be very helpful. And then, of course, they always tell people to stress that you guys are mandated reporters of child abuse and elder abuse, because at the end of the day, we don't want people to distrust us and the services that we have to provide. We just want to let them know up front, hey, we do have to report those things. But intimate partner violence in and of itself is not a mandated reporting opportunity in the state of Connecticut and pretty much every state. Because again, at the end of the day, if we were pulling the trigger on someone that didn't necessarily want to get that person in trouble yet, or follow up on anything, then we were causing more harm than good. We were putting people into these situations where now that person was infuriated and we were causing more harm. So that's why IPV, in and of itself is not mandated. But there's obviously a ton of situations where this overlaps. So we hear, if someone had their kid in their hand, obviously that's a situation where you have to make a report to DCF. So please, the best thing I can leave you with is, if you do have to make a report to DCF, to please also make sure that you are connecting that person to CT Safe Connect right then and there. So while you fill out that DCF form or something like that, say, hey, I just want to connect you to an advocate, so you can at least start a safety plan, let them know that this report is going in. You are going to have to re-enter that home to the person on the other side of this report who's now going to be pissed. So what can we do about that? Like, what can we do about when you have this conversation with them? don't have it in the kitchen because there are knives. Like all these different things that they can help like gather things if they feel as though they're not going to be safe to go home. They can at least connect with that advocate, and then at least moving forward, when they have to work with DCF, they also have that confidential resource on the side to specifically address intimate partner violence as well. I think that's where we really fall through the cracks a lot of times, is not letting people know what resources are out there. So at least trying to connect them and getting that safety plan right then and there, because we know that that person on the other side of that report is not going to be happy that that information got out. The crux of CUES, like I said, you don't have to necessarily remember the acronym, is just universal education. So letting everyone know that these resources exist. We have these cards that I can easily send to you. We have tear-offs, we have posters, but the cards are basically a really easy way to get resources into people's hands. So you can give it to every patient or client and just say, hey, we're giving this to everyone. On the inside, it just talks about what's healthy and what's not. And then on the back has the CT Safe Connect QR code and the website. And that way they can easily connect to someone if they feel like they want to at their own accord. Like, so we have people calling a lot of times saying, hey, I got this a month ago, but now it's a safe time for me. And it's a safe resource to give even if someone wouldn't separate from someone, because it, again, it doesn't talk about abuse. It just says, hey, we're giving this to everyone. And we have ones for teens. They say like hanging out, hooking up. We have pregnancy ones. We have LGBTQI ones. We have all sorts of different cards. They're just an easy way to make sure that you yourself are feeling okay, that you know they got a resource and left with it. And then also to know that that person has that resource. So again, at the end of the day, my biggest take home with CUES is that universal education. So this is a really simple script that you can use. And I actually just got it back from the translators. We have it in, I think, 8 languages now. So we have like Pashto, we have Portuguese, Polish, we have Spanish. So it's just a really simple script. So even if you don't have a translator, you can at least hand that to someone you're working with and they can read it themselves. Because all it's saying is, hey, we want you to know that there's healthy relationship resources here in the state. It's called CT Safe Connect. It's free, it's confidential. And if you or anyone you know could use it, here's the number and here's the website. And the reason we phrase it that way is just to make sure that people know, like, we're not pointing our finger at you. We just want you to make sure that you have this resource because, you know, you're meeting with us. So why not give this resource? And just a really easy way to get that into people's hands. And you can tell it takes less than a minute, super easy. So if you're screening, you can add that in right before you do your screening process. So if you're someone that goes through those set of screening questions, it's just a really easy way to know that even if they say no to all the questions you asked, they at least have those resources available for themselves to take if they want to, or they can ask, hey, could you repeat that phone number, things like that. And, you know, many of you have probably gone through these screenings a billion times and people don't necessarily always say anything to them because at the end of the day, we don't really want to just disclose our intimacies of our relationship with someone that is just going through a bunch of questions. So we know that disclosures are not always going to happen. So at the best thing you can do is just provide that education to individuals. But of course, if you do get a disclosure, we just try to tell people, don't panic. Try to reel in your thoughts of like, you should really leave. That's terrible. And just letting them know that, like, don't worry, like there's help out there, and let them know what you learned here today. Let them know what CT Safe Connect is. Let them know it's free. It's not attached to ICE, not attached to DCF, it's not attached to police. These are all things that people are really fearing when someone just says, hey, let's call a hotline. Like, why would I do that when I already don't trust people? So, and then of course, asking them, are you safe right now? So making sure that what their situation is it something where they literally can't go home today? Or is it something where they're just trying to assess the future of their relationship or questioning what their relationship actually is? So trying to encourage them to make that referral to CT Safe Connect right there or to your local member organization can be really helpful. But again, to like kind of give them an idea of what it is rather than just like, hey, let's call a hotline. We do see the greatest level of success when someone is able to connect with a provider and have that support to help them advocate for what it is that they need. I think a lot of people call our hotline and get really overwhelmed by everything and forget to tell them like half the story or things that might be helpful to assess their safety and things like that. So at the end of the day, it is their right to say no to any of those things. So I know it can feel very frustrating. You hear this terrible situation and then they're like, I need to go. What are you talking about? I got to get out of here. Like, I don't want anything. No, thank you. Or I don't want to talk with an advocate. And that can feel really like dangerous and scary. So what I encourage people to do is to know that that is their right, and ask them if they have a phone, like, hey, can we put this into your phone? So ask them like, who's your best friend or who's somebody you talk to often, and put it as a second contact. So like their fax number or their work number, or they can put it as a totally different contact, like Purple Ribbon or a pizza shop, something that they'll remember. But this way you can at least, of course, document for yourself that you gave a safe resource. And then you can know that they're leaving with that option, because at the end of the day, like I said, they might be on the clock. That person thinks if they're not home in 5 minutes that they're cheating on them, or they just can't believe they even said anything to you and they just want to like decompress and not talk about it any further. So again, just really trying to get those resources in people's hands and just reiterating why you are concerned. And then of course, whatever your role is, we don't want you to feel like you have to be the expert in IPV. Whatever your role is, whatever your program is, serves a purpose for that person. And the more they can connect with you or any programs you know out there, to remove them from that isolation. So things they've complained about, like if they need to help with food services or want to join support groups or something like that, like trying to keep removing them from that isolation. Those are all things that are going to end up helping to take those next steps.
So actually, I do have a quick comment. This is Rosemary again.
Yeah.
I wasn't quick enough to actually unmute myself and asking about screening for IPV. Definitely do that. We do that. And one interesting thing is that in general, when we do this on our DDAP, they say no to most of the times. And then we find out, throughout the treatment with us that there is, or there was, and so, and that's when we're able to address. But at first, and totally understandable, they're seeing us for the first time, admission team, it may not be the same people, which is usually not the same people who treat them, and at first they say no, they're not so sure whether or not. That goes back to a point about, trust and shall I disclose this now?
Yeah, no, thank you. That's a really good point. And it is like such an honor. I feel like when people do take the opportunity, like after a while, to trust you enough to say something, I think it's a really helpful thing to know, like that person does trust you enough, or they're feeling like that nervous that they actually do have to talk, because most people won't. And like you said, yeah, like over time, and that sometimes they just honestly don't know that is abuse. Like until they can hear, what is healthy, what's not, or like think about their lives, they're thinking about so many other things that they just don't even realize it as abuse. They just think, oh, well, they just had a bad day, or this is just how relationships are. Because most of us grow up watching what we see in our own home, and it probably is mimicking what they maybe saw as they grew up. So yeah, that's a really good point. So thank you.
Oh, thank you.
Ashley, I just wanted to echo that sentiment because I think it's a really important one. I think we talk a lot about that when we think about reproductive health integration. It's the same thread of you only know what you know. And so if you've been taught or you've observed unhealthy relationships or have unhealthy experiences about your body or have experienced abuse, in your early childhood years, that really does create a dynamic where some of this is normalized. And so I think the idea about handing out resources and just doing that education, I just really want to encourage folks to think about how they can take that back to their organizations and really sort of integrate, Rosemary, because I heard you say, and I know you all have great success, that there is a real vulnerability to making that disclosure, right? And so there's a real need for feelings of safety and security. And I think once folks have that ability to work with many of you on the line, they develop that over time. So I just wanted to sort of echo that sentiment because I think it's really important. And that would be my challenge for all of you. How can we take this back to sort of build this in so that we can really help give people information to keep them safe, and also sort of help recreate those pathways to the types of healthy relationships and information that folks deserve.
Thank you, Shelley. Yeah, no, that's definitely like what we're trying to encourage, and what we see through like a lot of the different studies we've been able to do and things like that is like when people do continue to take the time to just offer these resources or let people know that these things exist, like they will come forward with certain things, or they will start to realize, oh, this wasn't necessarily healthy, or things like that. So the more we can just like give these people opportunities to understand like where some of their trauma or one of the actions in their life have brought them to, like it's at least a helpful way to make people feel like not everything is their fault, and have resources for that. So we definitely have all of these cards. We have tear-offs, we have all sorts of things. So please let us know. And we obviously have trainers across the state that can come out and help in any way that is helpful to you as well. And just some reminders. We always just want to let people know that disclosure is not the goal. So at the end of the day, you're not doing a bad job if people aren't disclosing. It's just people are really guarded, like we just talked about. And just being able to listen and support victim survivors. They know their violence best. What we might think is safe and what we are instinctively inclined to think is safe, it might not be safe for them at that time. So really trying to work with them assessing if they are safe in that moment. If you have someone who absolutely refuses to make that call, our website does have really easy like walkthroughs of safety planning, things that you can at least help people start if they're willing, so that they have like the basic things. Like one big thing is if you have an old cell phone, even if hasn't been used in years, if it's still charged, it can still call 911. So you can like hide those in rooms that are safe, things like that. But there's a lot of little things that people can kind of start to think about if they are in situations where they're feeling unsafe. And of course, to remind people they don't have to say their name when they call, or if you can even show them the website, ctsafeconnect.org, like, hey, I'll show you how easy it is to connect with an advocate. It's not a robot. Just like simple ways to let people like feel like they're touching their toe in, but maybe, will take it at their own accord. And then please, especially in October being Domestic Violence Awareness Month, take the opportunity to call Safe Connect, get connected to your local member organization. They have so many great resources specific to your communities, and a lot of them are willing to come out and do trainings or support your staff if they feel like they just want to chat with someone about this topic, or get advice once in a while, things like that. They're there to do that as well. But yeah, thank you guys for listening to my talk. I always just end with success is measured by your efforts to reduce isolation and to improve options for safety.